Hello, I'm Robert McMullen. I'm a psychiatrist in New York City. I went to Georgetown Medical School in Washington, which is a great medical school, very nice place. And I went to my psychiatry residency at Columbia Presbyterian in New York. In 1980, I started doing private practice and have been doing it ever since. And I became known as being rather good with treating people with medications for depression, bipolar disorder, panic attacks, schizophrenia, and so on. In 2010, after I had been in practice 30 years, I obtained my first TMS machine. And this is transcranial magnetic stimulation, where a machine creates a powerful magnetic pulse and that pulse going on and off changes the electrical activity in the area of the brain below it. Other psychiatrists that had used it told me that they were getting close to 80% of people who had been treatment resistant all the way to normal. And after I got it, we were very gratified to see how effective it was. My wife and my staff were very against me buying the first machine, but it worked terrific. People that we had had for years and that other doctors had had for years and who had never been euthymic, never been in a normal mood in their life, 50% of people came all the way to normal in 30 treatments. Another 10% were on their way but stopped just before they got there. And only 10% had no benefit at all. Now, you might take an MAO inhibitor and it might work better than the ones you've taken before. But is it going to bring you all the way to feeling completely normal and not depressed? It's a very low chance of that. And this does it in such a high percentage of people. People stay on medicine after the treatment. We think it's best. It looks like it's prophylactic to keep the depression from coming back, because most illnesses like hypertension and diabetes and arthritis and depression are chronic. And so if you don't take some prophylaxis, it's very likely to come back soon. So usually people stay on medicine, the same medicine they were on before or less. We've had people that have gone over 3 years without relapsing. And here they had never been normal in their life, and then now they've been normal for over 3 years. It's just amazing. And when they do relapse, they don't need another 20 or 30 treatments. Usually it's just a few treatments, 5 or 6, sometimes even 1 or 2, and they're back to normal. And this is a revolution because it's a completely different modality. So people who have failed on medicines or cannot tolerate them have something that will work. And it has a long-acting effect. That is really amazing, because if you're treatment resistant and I put you on Parnate and you get a lot better, is that going to stay after we stop the Parnate? No. But with this, the benefit persists for a long time.